Welcome to Learning Plan 1. Learning Plan 1 covers day 1 of your internship simulation for this course. As you begin your internship, it's important for you to understand that we are going to use a specific set of dates so everyone is consistent in what we're doing. We are going to use September 14th through the 25th of 2015. So day 1 of your internship is September 14th, day 2 of your internship is September 15th, and so on. So anytime you're creating appointments, changing appointments, everything is going to hinge off of these dates. If you're asked to schedule a reoccurring appointment from today on, today is day 1, so today is September 14th. I know that's going to be a little bit confusing for you, but it's going to make it easier for us to be consistent for everyone in the class. So again, if you are working, for example, on day 3, and it says set up a reoccurring appointment for this doctor from today on, it's going to be starting September 16th and going for the next 6-month Wednesdays. So however far out that is. Everything is going to hinge off of these 2 weeks based on your internship. And you will be reminded each day what day you're supposed to be using for that internship day. So day 1 of your internship will begin with an introduction of yourself to your classmates. So what you'll be asked to do is go to Blackboard and again introduce yourself. I do have some suggestions there of what you can do or how you can introduce yourself. And then you will also be required to reply to 2 of your classmates. Make sure that what you post is meaningful. Don't reply to your classmates as nice to meet you. Create a conversation as if you were speaking with them face to face, and that goes for any of your discussions. Try to make them very meaningful and try to further the conversation in your replies. In task 1, you will be setting up the schedule for 3 doctors. The first doctor goes through in detail in your book, and it tells you exactly, it walks you through each of the steps. It tells you exactly how to set up those schedules, how to go into each section of the calendar, set up reoccurring appointments, things like that. And then as you go further through to the second and then third doctor, it doesn't give you those details. So if you're trying to set something up and you forgot how to do it, you'll need to go back into the original or into the first doctor to look at how to set up those appointments. In task 2, you'll be evaluating all of the schedules that you just set up for the 3 doctors, and you will need to look and see which ones have conflicts, which one has multiple things going on at the same time, and fix those, rearrange them, and then resubmit the same 3 schedules with those corrections. In task 3, you will be setting up an appointment for a patient with Dr. Martin. In task 4, you will be setting up an appointment for a patient with one of your doctors, and it'll be a new patient, so you will also need to set up the patient demographics. That is outlined in that task, so you'll actually be submitting 2 assignments or 2 documents for this task. Number 4 will require you to submit the doctor's day view of their schedule, so I can see that you did schedule that appointment for that patient with that doctor, as well as the patient's demographics. So again, those instructions were provided to you in the setup of how to print out, for example, patient demographics. In task number 5, you will be going through and updating the patient that you set up in task 4. You will be adding to her patient demographics page. So you'll be adding some information again that is provided to you in your book. and you will resubmit that patient demographics with the updated information. And as a reminder, I did mention this earlier, you do have specific days of your internship. Day one of your internship is September 14th, 2015. That's going to be a Monday, and everything is going to hinge off of the start of your internship. If you have any questions about this learning plan or any other content within this course, please do not hesitate to call or email me.